I want to welcome you all to Academic Affairs Town Hall with the units that report directly to my office and also library and grad school. So it's great to see you all. It's nice to have everybody together, even if we're not in the same room, which is unfortunate, but still good to see all your faces and see that everybody's out there and doing well. And it's just encouraging to have that opportunity. So I appreciate your time today. We have 81 people on our call, so we will utilize the chat feature for questions here in a little bit. And I will have Ginny Larimore, who is joining us from Marketing and Communications, to help us with facilitation, go over that process. We'll do that in a few minutes, but I just want to thank Ginny for her help and support, and that of Marketing and Communications in setting up these town halls for us. We have a very brief agenda, and then we will open it up for questions for all of you. I know that there are a lot of questions out there about how we will phase in back to work, where we are in terms of the health of the state and the health of our communities. So I have Rex Force on the call to give us some updates. We've actually had some updates from the governor's office today. So this is essentially breaking news, and we'll do that in just a minute. Before we do that though, I wanted to thank you all for all of the work that you've done, and do that in a different way than we've been thanking faculty. As you know, we've done a lot of, and we have faculty on this call, so I want to make sure that we continue to support our faculty in what has been a really tremendous transition for them. But that could not have happened without all of you on this call and the various ways that your offices and your staff have implemented our transition to distance for spring, but also all of the other things that we've asked you all to do. It's really the staff who have created the backbone that's made all of these transitions possible, and many of you are on this call today. So our teams in the library, in the grad school, in institutional research, in the Student Success Center, in the various offices that report directly to the Provost's office, and to ITRC, which is probably the epicenter of the work that we've had to do in the last couple of months, and completely unprecedented and surprising. So to all of you, all of your hard work, all of the late nights, all of the anxiety, I want you to know that we appreciate your work, and that it is valued, and that I understand, even though if it's not as clear in some ways, the work that the staff do as the work that our faculty have done in moving their classes to distance, it is just as important and valuable, and I understand the hard work that you've all put into that effort. This has been a difficult time. There's absolutely no other way to say that. It has been devastating for many families. It has been difficult not to be with our colleagues. It has been scary in a way that I think none of us have experienced in our lifetimes. And I want to also give you a little bit of reassurance about those things, about how you are feeling. From a historian's perspective, we know that the period of time that we're going through right now is not anything like any of the periods that our peers have gone through. This is unprecedented in the modern era, and really the only comparison to it would be the years leading up to World War II, and then the war itself, and its impact on the culture and society of America. So we have to go back quite a ways, a couple of generations, to get to anything that even approximates the experience that we are all having. And we don't have the benefit of being able to talk about that with peers and mentors, because most of the people who experienced those events, certainly in middle age, are not here. They're not here to help us with that. But we do know from studying those time periods that the experiences that we are all having is very normal. These are very normal experiences. They are periods of fear and emotionalism that might feel unfamiliar. All of that is normal. And our previous generations experienced that same thing during wartime and during the Spanish flu, for example. So don't be too hard on yourselves during this time period when you're feeling those feelings, because while we haven't experienced it as a culture and as a society, certainly our predecessors did, and they came through it, and we will too. With that, I want to turn it over to Rex, who is, I believe, on the call and can give us a little bit of an update on where we are with our trajectories in Idaho and in our community, and what the governor's Reopen Idaho plan looks like, although we've only had about 45 minutes to look at that. So I will turn it over to Rex.
Okay. Laura, do you want to have Ginny do a little bit of a orientation to how to use the chat feature and that kind of thing?
Oh, good idea. Ginny, if you could just walk us through that so that if there are questions for Rex, we can handle those right away.
Absolutely. So to take questions, we have a couple of different options. The first is just to kind of show you, I want to show you where the chat feature is. So if you hover over the video Zoom screen right now, you can see at the bottom there are some icons, and if you'll go kind of to the bottom middle, you'll see one that is for chat. And so once you click on that, your chat feature will open up to the right, and then I'm going to send everybody a sample chat right now. There we go. So you have two options. One is you can ask a question to everyone, like this was just done right here. And then if you want to ask a question anonymously, you're absolutely welcome to do that. How you do that is you go to the blue drop down, you select my name, and then once you find my name, select it, and then beside it, it'll say privately in red. And at that point, once you start typing, when you see that, you know that you're talking just to me. And then I will ask the questions in order unless there's a follow-up question that makes sense to what we're currently talking about. And then all of our town hall meetings are being recorded and added to isu.edu/town hall. And so if you missed one, or if you'd like to see a different one, for example, we had coffee with Kevin this morning, those will all be archived on our YouTube account and then added there. So you can access those at any time. There's about a 24-hour turnaround period to get those up there, but they should be up there shortly if they're not up there already. And I'll turn it back over to you, Laura. Thank you.
Thanks, Ginny. I appreciate it, and I appreciate your hard work in moderating all of these sessions. I think Ginny's been in something like 12 hours of open forums and town hall meetings. And with that, we'll let Rex give us our update.
Okay, thanks, Laura. Hi, everybody. Laura's correct. We just got some, I guess, news about the governor's plan to reopen Idaho. There is a website called reboundidaho.gov. Has a lot of information in it. There's a lot to digest. I haven't had a chance to go through all of it, but much of it is related to sort of the public health infrastructure and our abilities to do testing and contact tracing to be able to monitor the illness in our state. And then the other piece of this is really related to the trends of the illness itself. And we are seeing a definite flattening of the curve over time. There is a really nice website with some data visualization software called Tableau on it. The website is coronavirus.idaho.gov. You probably can link back and forth between the governor's plan and that other website. So if you have an interest in actually seeing the data, there's county level data. It shows some of the trends and the graphing of the cases over time. We're definitely in a tailing portion of the curve right now, so that the social distancing efforts that have been ongoing now for over a month are making a difference. It's interesting, we are actually seeing fewer cases of influenza and just common colds and other viral illnesses as well, likely related to the social distancing. I mean, all these viruses pass from one person to the next through a fairly similar mechanism. And so these efforts clearly are affecting other kinds of illnesses as well in the state of Idaho. We're sitting at about 1,800 cases, just over 1,800 cases that have been confirmed or strongly suspected. There's a percentage of those that are probable cases that may not have had confirmatory testing. And we're sitting at 54 deaths. That is, for every 33 cases, there is one death of those that have been reported thus far. Now, with the testing availability, which was very much limited early on, it's more widely available now. We clearly don't have a good denominator for how many cases have actually occurred in the state. And you all have read and heard the stories about how this illness can cause very mild symptoms in some, in fact, even potentially asymptomatic in some. So we really don't have a good idea of the true, what we call case fatality rate. But I do want to point out that it's important that we maintain the social distancing and that we maintain all of the disease mitigation efforts, because this illness is quite a bit more severe, probably in the range of 10 times more severe in terms of fatalities than influenza. And so the next question is, well, if the governor has a plan to open up the state, how does that affect ISU? The problem is that it takes a longer time to recover from not just the illness, but the effects of the illness on the economy and our institution than it does to implement the strategies to rapidly sort of shut us down. So we made those transitions over, basically a 2-week period right before spring break. And it's going to take several weeks for us to ramp back up, not only as a society, but as an institution and in our communities. This is because we have to check a bunch of boxes as we do that build out, and we have to accommodate the potential for new illness occurring. We have to accommodate the issues associated with sort of reindoctrination or reintroduction of our faculty and staff on campus, the effects of students, how are we going to manage housing, how are we going to continue to manage instruction, and that sort of thing. So we just today actually have a task force work group that has formed up to begin to talk about how we're going to reopen various aspects of the university over time. And I think the governor's plan is going to provide a little bit of a template for us moving forward for us to be able to do that. I know that you guys are joining from across the state. Boise is affected differently than Pocatello, but we're dealing with a statewide plan, and with the ability of people to travel. The virus could easily travel to different areas, and we could see a surge or a blooming of illness through this reopening plan, which will then set us back. And we'll then have to go backtrack a bit and have some isolation again to a greater extent before we can then move forward. And that's relatively common. That's been shown in other areas with COVID, and it's been shown with other epidemics like influenza, where the mitigation efforts are relaxed, and then there is a second surge of illness. So we're going to have to be cautious. It's going to take time. And if you look at the public health guidance that's out there, even from this point forward, or even let's say the April 30th stay-at-home order gets relaxed a little bit, it's an 8 to even 16, 20, 24-week process, depending on all the different milestones that need to be met, primarily from a public health perspective and keeping a lid on the disease itself, that we don't see a surge in cases. So we're going to be into midsummer. I know the governor's targeting late June for being able to sort of be back to normal. I'll be surprised if it's then, but I do think with the trends the way they are, and that if we don't see a sort of rekindling of disease, it's possible that we could meet those kinds of timeframes and be back to a fairly similar, a close state of normal by the start of fall semester in August. So I'm happy to hang around and answer any questions. You can send those through to Ginny or to the group. I'm sure there are some specific questions that people have. Like, I think Ginny and I have been seeing way more of each other than we ever have up until now. We've been in hours of these meetings because I've been sitting in with health town halls, finance and business affairs, and academic affairs. I've got almost as much time logged as Ginny does, it seems like. But I'm happy to hang around and answer any questions that people have.
So any questions for Rex? Looks like we don't have any, Rex. Oh, maybe one.
Yep. What about faculty at risk?
So I think that's a really good point, and that's one of the things that our working group has already begun talking about. We're going to have to, I think, have some accommodations in our plan for faculty that are at higher risk and for even students that are at higher risk. So as we move through this planning process, we absolutely want to take care of the faculty and staff who have higher risk. The risk factors that have been identified for people that have more severe illness include advanced age, obviously, but other comorbid conditions, things like diabetes, heart disease, lung disease, obesity, immunosuppression, things like that. In some areas, the vast majority of cases and fatalities, well over half of the cases have been in places like nursing homes, where it's elderly, chronically ill that then have a very much more severe illness. They also have very close proximity to one another, and the disease gets spread not only amongst the residents of a nursing home, but also amongst the healthcare staff there. So those risk factors are being widely identified, and we will, in our planning, have accommodations, if you will, for the contingency of faculty that are uncomfortable having a lot of students. We're probably still going to have some online courses. We will likely have smaller sections in some cases. We don't have a large number of large classrooms, so we're looking at our inventory of the different classrooms, what those capacities are, and how this is going to translate into the number of sections that we need to have to be able to not only maintain distancing and be able to fall back in a contingency plan if we have to, but also to protect students and faculty that might have additional risk factors should they become infected. It's a really good question, and we're definitely going to consider that very carefully.
Okay. And Rex, on a partial follow-up to that, about at-risk faculty switching to online classes, and I guess that's more of a Laura question, but maybe you can address that.
Well, I think that we will have to have some opportunities to be able to do that. And Laura and I have talked about that already, that we may change the structure and the number of sections and the way that we fill our classrooms in a very significant way for fall semester. And I personally think we should plan on that, just so we have that contingency in our back pocket. We can hope for the best, and I think plan for the best as well. That is, that we may be back towards normal by August. But I think the other issue that may occur is that if this disease surges again or blooms again, we're going to have to backtrack quickly. And so we definitely need to have those plans in place. And we don't have all of it done yet, but we're definitely considering all of those things.
And related to that, Ginny, we are creating a working group in academic affairs. We just started that today, that will report up to Rex's steering committee, which is looking at how we open up the campus as a whole. The working group that I'm referring to is will look at the fall class schedule and help us with scheduling issues and options for students. We envision some of our vulnerable student populations wanting those online options as well. So we will be working through that in the next few weeks.
And what about staff with family members at home with them who are at risk?
So, you know, there are some accommodations already in place for people. You know, I think that as we roll out our staffing plan, that is a movement back from telework to on-campus work, we're going to need to have those kinds of accommodations. And you know, already there are some federal programs that have been put in place where people have additional sick leave opportunities. You know, we're heading into summer, and school's out obviously, but school will be out officially. And so the daycare options, there are just a lot of factors that I think we need to consider as we look at restaffing the on-campus work. And I think that we're going to be able to accommodate most people to be able to either continue to telecommute because of the at-risk people within their home, or be able to come up with alternative work arrangements to meet those needs. It's very complicated to think about all of the unique situations that are going to be present in each administrative unit and academic unit on campus. Not only that, in each of the curricula, right, from courses in the College of Technology to those in health sciences and other disciplines that have a lot of experiential component and are out in the community, to other delivery methods of our more traditional didactic curriculum. So there are a lot of nuances here, and we certainly want to hear from people. We want their input. We want to know their certain situations because they're likely not alone in dealing with those issues. And we will do our best to absolutely accommodate those so that we're decreasing the risk of this, you know, of transmission of this illness.
Next question. Would we consider not having students meet quote unquote normally this fall, even if the K-12 system is back to meeting daily?
I can take a crack at that, Laura, if you want me to. I guess I would predict that our fall, this fall, will not look like other falls, that we will have like the fall semesters that we've had in the past, that we will have more options for attending. We will have different section sizes. We will have you know, different and probably much increased online activity for many courses. And I think we're gonna have to do that because of the issues we've just been talking about.
Okay. And this is a follow-up question about accommodations. How can we manage these accommodations without violating personal health, privacy, and HIPAA?
Well, we have to be careful with that. You know, there are some of those HIPAA requirements and other things are relaxed a little bit in an epidemic situation, a state of emergency. We certainly don't want to violate people's privacy, but we also you know, need to be able to take into account their wishes and their needs, and frankly, their health is at the top of that list. So we're going to do our best to not violate HIPAA, but to be able to meet the needs of our faculty and our students. And you know, if we need additional guidance on being able to deal with the HIPAA-related issues, we'll absolutely obtain that.
Working from home has been an option. Will it continue to be an option for those at risk who live with people at high risk?
I think it will, yes.
Okay. I think that's all the health related questions we have right now. We have some questions for the library and one for the grad school.
Okay, I think we'll just hold on those for a minute while we transition Ginny to the questions as a whole. I do have two co-hosts today, Sandy and Adam. Sandy for the library and Adam for the grad school. And I wanted to give them a few minutes to update you on things that are occurring in their unique environments in library and grad school, if they have updates they want to share. And I want to thank Rex for his time today. And Rex, you don't need to hang on the call. Appreciate your time.
Oh, thanks. And if anybody has any other questions, Laura, can I just say one other quick thing?
Oh yeah, go ahead.
Sorry, I forgot to mention. We have on-campus COVID testing. We actually have a drive-up clinic that just started today. It's the only one in town. It's in collaboration with the health department. And you do need to have a physician's order or at least be screened through the health department. So if people, family members, friends have symptoms of coronavirus infection, we can do drive-up testing. It's right up behind Reed Gym at the east entrance to Dyer Hall. And so I would, one of the things I didn't cover is if people are sick, we shouldn't be coming to work. We should be staying at home, and we should be doing plenty of testing. That's part of this whole mitigation process. And for meeting the goals of reopening the state, we need to be doing more testing. We will likely be doing antibody testing. That is the body's response to the infection to determine who has been infected and who has protective immunity or what's believed to be protective immunity. So there is going to be ongoing efforts in that way to identify truly who is infected, who has been infected, and how that then affects our ability to reopen the campus. So I just wanted to say briefly, Laura, that we do have opportunities on campus for testing that can be also reached through our university health service.
Great. Thanks, Rex. All right, let's move to any updates from the library or anything else, Sandy, that you want to add.
Okay, great. Thank you, Laura. I want to say that I appreciate the opportunity to talk in this way through this town hall and to take questions from anyone about how the library is doing. I would first give a big thank you to the library staff who have, like our colleagues, have made the transition very quickly and are dreaming up creative ways to continue our obligation for service to the faculty and student body. I want to let you know that all of our services are functioning and in online form. And that includes services such as interlibrary loan, book checkout, although book checkout will be mediated or is being mediated. If you let us know a particular book that you want to check out, we will go collect it and put it in the mail for you at your request. We've extended all due dates to May 6th, so and waived late fees. You can return your books in the book drop in Pocatello. Another service that we are continuing is chat and online reference. We have folks staffing that and who are ready to help you if you have a research question or a bug or are stumbling to get access to a particular resource. I do want to note that there was a period of time, and it still goes on, that many of our interlibrary loan partners across the country are shut down, as you know, and that limits our ability to borrow books from others. And so we've seen a drop in the responsiveness of our interlibrary loan partners, a completely understandable drop. So I would ask that you help us to make that work in some way, and we'll keep trying, but we may have some delays in getting materials for you that are in book form from other libraries. Lastly, I want to say that we are communicating changes in policy and services through marketing and communication, and you may have seen those in the periodic releases that Marcom puts out. So if you're curious about a particular service or have a question, be sure to keep an eye on those. That is how we've been asked to communicate, and so that's how we're doing it. Of course, you can always ask a question directly from the library homepage, which is /library after ISU's site, isu.edu. So those are the points I wanted to make, and I'm happy to take questions.
Thanks, Sandy. I think we'll have all the questions at once. So we'll move now to Adam with the grad school.
Hi, everybody. Afternoon. Good to see everyone here. We have a lot of participants that have filtered in. That's great. I'm glad that we have so many with us. For those of you I haven't had the chance to meet, I'm Adam Bradford. I'm the incoming dean of the graduate school. I've only been here now since about the middle of February, so a lot of new faces for me. And you can imagine that it's been quite an experience to come in, and within a few weeks we're rolling into COVID management in the graduate school. I wanted to sort of start and echo some of what Sandy just said. I'm incredibly grateful for my staff, who have been amazing through this, and many of them are on this call. They have been very, very supportive, and their focus is right where it should be, which is on students. I'm also grateful to the other deans and to Laura and her office who have made my transition very, could have been a whole lot rockier, but it's been relatively smooth as a result of that support. Things going on, graduate school has faced with you a lot of these challenges related to the transition to a distance learning environment, and the way in which COVID-19 has disrupted our students' educational experience, and trying to mitigate that as much as possible has been our goal in the graduate school. And so we've tried to really stay student focused during this time period. That has been our biggest mission, is how can we continue to support our students during this tough time. And so we immediately, we've moved all of the thesis and dissertation defenses to an online environment. And I'm grateful to report, and this is a big shout out to my staff, that I've heard now from a few different programs and departments that process has been relatively flawless, and students are still able to make progress. And I'm really grateful for that, because that's a tough thing to have to, a dissertation or a thesis defense is tough enough. Having to make a last minute change and move that into a virtual environment, it just adds another wrinkle to that process. We managed to, and another big shout out to some heavy lifting from my staff, to transition our research symposium into a virtual environment. And we had several faculty. The faculty were amazing too, just stepped up. We put out a call for faculty judges, and we were overwhelmed. We had way more willing respondents and judges than we had need for. And that was just really heartening to see the faculty community come together to support the graduate students. Really grateful for that. And a lot of hard work went into making that happen. Our graduate students appreciated it. It was they're not having a whole lot, well, at that point in time, academic conversations had been disrupted, and we were able to get back together and have some of those and let students talk about their research. And it was great. It was very appreciated. So we're glad to be able to do that. And we have a number of virtual research symposium t-shirts left over. So I know when we're all back together and we're milling around, just come by the grad school. We'll hook you up with a research symposium t-shirt. I think Stacy Phelan got one. I see her on here, but I've got some for the rest of you too, if you really want them.
I did, and they're great shirts.
I'm glad, Stacy. We've also been working, that's some of our, sort of front-facing things that we've been doing to manage COVID-19. We are also, working hard on what I would call sort of the back end, in terms of, I've got a number of folks that are working hard to get students graduated and out on time. And that has required a lot of coordination with accrediting bodies and with outside the institution. And then of course with academic affairs inside the institution, looking at term date extensions. How are we going to process paperwork? How are we going to get our students into some of the clinical experiences that they need, for instance, and keep them marching towards degree? So we're fielding a lot of questions about student progress and challenges related to just sort of helping students graduate and be able to achieve their goals. But I feel like we're hopefully staying on top of that. It seems like it from our perspective now. So hopefully that is the case. And then we're working on, we haven't given up on our initiative. So we keep moving forward, trying to provide better service to the university and better support through the development of some of our internal initiatives. We've got an initiative with document processing using DocuSign that's going on. And for anybody that was at our grad program directors meeting, you know that we're still moving forward, trying to roll DegreeWorks out, which will impact advisors and faculty and students across the institution that interact with graduate students. And so that's just a few updates, kind of what we've been doing. I'm really grateful to this institution. You guys have been an amazing place to be for the last couple of months, even with all of this going on. So I'm very grateful for the opportunity to be among you.
Sandy and Adam, thank you for those updates, and thank you both for your service. Both of you are new in your roles. Sandy's been the interim dean for a very short time and now is the permanent dean for an even shorter time. And Adam has had probably the most unusual transition for a new dean that I have certainly ever been connected with. He arrived a few short weeks before our COVID response really kicked in and has been working virtually ever since. So great to have you both and appreciate the updates. At this point, we're going to transition to questions. Feel free to send those to Ginny anonymously or just post them on the site. And then Sandy and Adam and I will answer the ones that are aimed at us. I also want to thank very much Glenn Nelson, our Vice President for Finance, who has logged a lot of hours on these meetings as well. I think about as many as Ginny and Rex have logged. And he's here if we have questions related to the budget process in total. And we have Stacy Phelan on the call too, in case we have questions about admissions or recruiting. So thank you to all of you for joining us, and we will open it up to questions.
Thanks, Laura. The first one is actually the first four are for the library and for Sandy. Number one, what are the plans to move the library into the 21st century, particularly guaranteeing the broadest possible access to electronic sources, especially books and OUP handbooks, particularly now that we are all working remotely?
Plans for the 21st century. We are committed to providing the access that we are able to provide, that whether it be free or licensed access. I am guessing that this questioner is a member of the faculty, just by judging by the nature of the question. And I would urge you to get with your counterpart in the library. Each department has a named counterpart in the library who could talk the specific details with the resources you are concerned about. You can find that information on the library homepage.
Thanks, Sandy. Number two, have you done any audit of book and journal requests to identify the biggest hole in the library resources?
We do an audit of sorts on an ongoing basis. Periodically, we review the interlibrary loan requests to borrow and address those as our budget allows us. We are aware that we are limited in what we can offer, but we are quite proud of our interlibrary loan department, who has learned to rapidly turn around requests and to deliver them electronically in most cases. So yes, we're auditing, we're aware, and we are responding as we are able.
Related question to that. Have you
Okay.
done any audit to identify books and journals that are never used and figured out a way to discontinue them?
We have. We also look at use statistics of our digital materials. We review those regularly to determine what could, say, be swapped out for another type of resource. We also, as you may know, we have been looking at targeted right now at nursing books. We've been looking at our nursing collection in in hard copy form to analyze that particular collection with an eye toward use, with an eye toward availability in the region, and with an eye toward age. And we are looking at one day when we can go back into the building to withdraw some of those materials on a selected basis.
Next question, have you considered revamping the way in which the library identifies the need of sources, moving away from asking faculty to identify individual books and journals to trying to give us the broadest access possible?
Well, I would say we do that, a combination of that right now. We have counterparts on the library staff who are in charge of a particular discipline, that is, who are given an allocation of library funds to build the collection, both in collaboration with faculty as well as based on industry reviews, on studies of the literature. And so that these folks on the library are authorized to make these purchases and do. So I urge you to contact your counterpart in the library and find out more.
Okay, thanks, Sandy. Next question's for the grad school. Adam, is there a different process for assigning incomplete grades this semester for graduate coursework? The Provost form seems to only be for undergraduate courses.
That's a great question. Yes, we did. So that incomplete sort of mechanism that we put into place is targeted pretty much solely at the undergraduate population. We feel like we have additional mechanisms to deal with this at the graduate level if we need to. And I'm happy, I think it probably needs to be addressed on a sort of case-by-case basis, and we're happy to consult with anyone that feels like they're experiencing difficulty either getting students through or students that are experiencing difficulty, so that we can continue to help them move towards successful completion of their degree. But yeah, that's probably about all I have to say about that. Happy to take a follow-up question on that if there is one.
Thanks, Adam. Another one for you. Will the GRE, MCAT, and other similar requirements be waived this coming year for the graduate school, as is happening with the ACT and SAT?
So the graduate school currently doesn't require GRE scores across the board. Program requirements might be different. So you know, the minimum requirements that we set as a university might be different from the minimum requirements for particular programs. And so it's kind of a tough question to answer, because while the university may not be requiring the GRE any longer, other programs may continue to do so. I will say, just in general, I haven't seen across the discipline, across the academy, I haven't seen a move to waive GRE, MCAT, and other scores. GRE's been taking some fire for some time now, but those other tests, I haven't seen them being moved to waive those. In fact, what I have seen is a response from those testing organizations to make in-home proctored exams possible. So if you've got students that are interested in, attending grad school, we want to make that as feasible for them as we can, at the same time that we vet the appropriateness of their candidacy in a program. So I would say that it is good that programs be thinking about what their requirements should be and whether those should change in response to the conditions we're currently facing. We would certainly support that kind of review in the from the graduate school's perspective. But then I also think that programs should be aware that there's, like ETS, electronic testing service, that issues a lot of those kind of standardized tests. They've been very proactive in rolling out at-home test options for those students. They are proctored exams, they're proctored virtually. So trying to be able to minimize the disruption to that process as much as we can.
Adam, a follow-up question on grading. Who should we ask at the graduate school regarding I or IP grades? Should we contact the graduations or the graduate school prior to the registrar's office?
I think that would be wise, and I think that they can reach out. I mean, if we're talking about individual instances, our office would be, we can definitely chat with folks about best ways to move forward as it relates to those students. If we're talking about an entire section, definitely, right? We need to be kept in the loop on that, and have the opportunity to chat with programs about the difficulties that they are experiencing.
We have a general recruitment question. Does the university have a strategy in place to increase the capacity of enrollment in our online programs? If yes, what is the marketing strategy to recruit students into those programs for the fall 2020 term?
Jenny, I can take the start of that, and then I can have Stacy handle the recruiting piece of it. Our deans right now are working collectively to identify opportunities for online options within the colleges. Some colleges already have a lot of online programs that are at capacity. So like in the Division of Health Sciences, for example, and some of you are from the division and certainly are well aware of this, but the division's looking at, how can they expand those seats? And then in other colleges, like the College of Business, for example, looking at expanding online options for programs that they're seeing increased growth in, and expect to see that in the fall. And then all of the colleges will be working with the working group that I mentioned earlier to make sure that we have online options in various ways in our phased plan for students, because as Rex said, we really do anticipate that we will need some different options in the fall than we are used to having. Even though we are planning to be completely face-to-face, we anticipate that some students just simply won't be comfortable in a face-to-face environment, that some faculty will opt to be online as well. And so our planning will take that into account. And with that, I'll let Stacy talk about recruiting.
Thanks, Laura. So what we're trying to do is we are in the process of hiring a transfer coordinator position that will be located on the Idaho Falls campus. And this is in part to focus on adult learners. We're working really closely with Lyle Castle on that initiative. And so some of those online programs are probably going to be targeted to folks in that category, the adult learner category. So that's one thing that we're currently doing. Another thing that we are able to do is work directly with deans as they're bringing some of these programs online. If they can connect with us and let us know who they're trying to target to get into those types of programs, we can work with them to help them reach the right populations.
This is a follow-up question for Stacy. Stacy, what can a general employee do to help enrollment right now?
Right now, our focus is on personally contacting every one of our admitted students. So our team is pretty focused, and they've got specific training to make sure that they're getting the right types of questions answered for those students. What a general employee can do to help us is if they are interacting with a student that has questions, to refer them to our office, especially when answering questions that are very technical in nature, especially dealing with something like financial aid or scholarships. It's best if they would refer them directly to our staff so that we can get them the right answer. But any interaction with a student being a positive one, rather than transferring them a lot, if they can just make sure they're getting them to the right place the first time, and then just sending students our way is the best thing they can do.
Great, thank you, Stacy. Laura, that's all that we have right now. We might want to give a few more minutes in case people have more, but that's where we're at right now.
We have some directors on our call as well. I know that Blake has logged in. I think that we might have Vince Miller here. If any of them would like to give updates, we could certainly do that now. Blake, do you have anything you want to share with the group?
I think the only thing I would say is that we are aware that there's going to be a lot of alternative delivery this summer and even into the fall and perhaps even spring. And ITRC is ready to help each faculty, especially this summer. And we're going to come out with an announcement or an invitation, maybe is a better way to say, to sit down with one of our instructional design partners and help everybody try to get ready as best they can. We made this initial transition very fast. We're hoping to be able to spend more time with faculty on courses to help improve the online presence and the online experience for the faculty and especially for the students over the summer. We're hoping to be able to do that. We'll get some announcement out about that. But any faculty that are involved in on this particular meeting or that we're in contact with, we certainly want to invite them to take advantage of what we can offer in the ITRC.
Thanks, Blake. Vince, I know you're on the call. Do you have anything you want to add at this time?
No, everything is going fine. We've been supporting Corey Zink's efforts in academic advising. They're reaching out to student enrolled for fall, and we've been slicing and dicing data for that for him on a daily basis. But other than that, it's data request, and so that's about it.
Thanks, Vince. I appreciate it. Stacy, would you like to talk just about in general what's happening in enrollment management?
Yes, thank you. So what we are doing right now to reach out to our students, we're hearing a lot of information and we're getting a lot of data about students and what they're experiencing. And a lot of them are experiencing some uncertainty. They're not certain what they're going to do in the fall. They're delaying their decision about where to different things happening with our students respond to that. So the first thing we're doing is we're up. I'm sorry, go ahead.
Stace, you cut out a little bit. Could you start that over just a bit? Yeah, sorry about that. You froze.
No problem. So we are hearing from research that's been conducted that students are delaying their decision to attend college. They're not deciding right now where they're going to go. Some students are choosing to stay closer to home. Some students are choosing to take a gap year. Students are changing their first choice of college as a result of this and how it's been handled. So there's a lot of indecision for the students at this point. So what we're doing to assist students is we are reaching out with personal phone calls to every one of our admitted students to help them as they are making their decisions, to connect them with the resources they need, such as financial aid or scholarships, so that they can make a good informed decision. We are also hosting a number of Zoom sessions that cover a wide variety of topics where students can select a time that works for them to cover next steps, financial aid, talking to current students. There's a session for prospective students to kind of allay those fears and let them know how we're going to be able to help them get connected on campus when they get here. We're also reaching out to students to help them get signed up for pre-orientation, which is a requirement for our freshmen. And we're seeing a good response of students that are signing up for that. So that's really positive. We also made some adjustments to some deadlines. For scholarship, we have adjusted the award acceptance date. So typically we ask that students accept any scholarship awards by May 1st. But because we know students are struggling to make decisions for what they're going to do in the fall, we've extended that date to July 1st to give them a little extra time to decide. And we've also extended some scholarships, our auto match scholarships in the BOSS system, to June 1st. So students who maybe are deciding they'd like to stay closer to home have an opportunity to get some additional scholarships. This is not our grid scholarship. That deadline was on February 15th. These are the auto match scholarships in our BOSS system. Financial aid is reaching out to students who have not yet submitted FAFSAs to help them get that process completed. And so there's just a lot of general types of things that we're doing to kind of let students know we're here, we care, we're connecting, and we're helping them guide through the next decisions that they need to make as they decide where they're going to go this fall.
Great, thanks, Stacy. Any other questions, Jenny?
Yeah, thanks. We have a shout out to library chat. So a new feature that the libraries are doing. You can chat to them. And then there's a shout out to Lisa Kidder and ITRC, who has been amazing, this person says. And then final question, does anybody know approximately when we'll be physically back in our buildings? Perhaps not next Friday.
Well, since we don't have Rex, we won't have the health perspective on this, but based on what the governor's guidance is, and you can all go out to that website, it is a phased process for Idaho back to work. ISU will align with that. At least that is my understanding. Our emergency meeting, COVID management group meets, oh, Rex is with us still, meets in the morning, and we will be talking about that. But it does appear that there will not be a complete back to work until probably July. Is that your understanding, Rex, based on that phasing?
It's a little hard to tell. I was actually reading some of the governor's plan as others were talking here just now. It is definitely a staged approach. It won't be happening next week, but they are looking at opening certain critical areas, including daycare and that sort of thing, even in May. Because obviously that's imperative to getting people back to work, is providing the right kind of daycare. I think there's some concern about that, right? Because virus can spread within those populations and spread to more vulnerable populations, even though children don't seem to be the worst affected for sure. But I do think that it's unlikely that we will be back to normal by the end of June, but the governor's pushing for that. And, you know, we can certainly hope for the best and continue to do our part. But we will be developing the ISU plan on the fly here over the next couple of weeks and be ready to adjust on the fly as well.
Thanks, Rex. Laura, that's all we have.
All right. Well, that completes our time at an hour. I promised that we would stay to that. I do want to say that we will have more town halls. We will have a round of these again once we get through the budget process, and we'll have an update on budget. Glenn was with us, but didn't get budget questions, so we'll save those for next time. And then we will also update everyone on where we are with our back to work plan, but certainly by that time that will be more public anyway. We plan to have those town halls probably scheduled late May-ish is what I'm thinking. So you'll see those pop up on the calendar. We will use the same format that we used this time and the same groupings. So this grouping will stay the same. for that next round of town hall. So be looking for those. If you have questions or concerns for the Provost office, please feel free to reach out to us. We are available, and Callie has been doing all kinds of valiant efforts to maintain my virtual calendar. So we will be here if you need us. And with that, I just want to say it's great to see you all. Appreciate the time that you spent, and please take care of yourselves. Stay healthy. That has to be our focus and priority at this time. And take care of your families, and take care of your neighbors. And we will see you all soon.